policy, and it is it is a great honor and pleasure to introduce Professor Ramesh of Lee Kuan Yew School of Public Policy, which is a strategic partner of Graduate School of Public Policy. Professor Ramesh is a very established scholar. He worked at University of Sydney, University of Hong Kong, and several other institutions, and he has kindly agreed to join us here today and share some of his thoughts on health and health policy. So, the floor is yours.
Okay, thanks. I'm glad to see so many students from the class here, because all the topics I could have spoken, I thought if I speak on health, maybe I'll have a few more people. And I'm glad you did come, otherwise I will have a very lonely presentation. And actually the theme, if it matters, we'll continue on to the class later on. What we're trying to do is, what kind of health care systems work? It's a big issue. It's, because it does cost a lot of money, and a lot of people's lives are at stake, literally in this case. So what I'll look into some of the established orthodoxy, things that look like common sense. And when common sense is backed by theory, it looks, real rock solid. But we're not interested in common sense or theory necessarily in today. What we are interested in, what works. And I look at two cases here, which together is almost half the world population. So we're not talking about just two countries. We're talking about half the world. Collectively, they are now the largest and I believe, the fourth largest economy. So again, even in economic terms, form about a third of the world economy. So by any measure you look at it, what we see here, and not just matters to the people of these countries, it matters to the world. If nothing else, it's half the world population. What I want to do is not look into the history of the reforms in these two countries. That will be too much for this session. We can discuss that later if you're interested. What I want to do is look at the reforms in the 1990s. And the reason for doing that is that this was the time when two countries pursued reforms that mixed a lot of common sense. And it was fully consistent with the economic theories, many things that you learn in your classroom. That competition work, if people pay money from their pocket, it works. People are more responsible, and so the quality improves. I thought, well, is that what happened in these two countries? And we'll find no, it doesn't happen. It didn't happen at all. In fact, absolutely the opposite happened. Economics, the discipline of economics may not have any answer for that, but in public policy we do have an answer if you look at the right place, which is not often the case. And the reason is actually very simple. We have known this for decades, that healthcare sector has a lot of market failures, and they are deeper than people and policy makers are willing to admit. Why are they unwilling to admit that the market failures are very deep and pervasive? A, because it contradicts their fundamental assumptions, and B, too much interest is at stake, interest of the elites. So if we have the interest of the elites and economic theory behind you, you think that you are invincible. You find that that was not the case. We had disastrous consequences in both the places, and fortunately, in the last 10 years, both governments have been reversing. And that's why I don't cover the recent period, because even the governments in those two countries have realized that the paths that they had taken, some of you may already see the connection and parallels in Kazakhstan. Right? We did a similar thing here. We got a little too excited about what markets can do, only to be wiser after causing a lot of damage to the people and the economy. So what they did, what both China and India tried to do in the 1990s was reduce the burden on the government. Both governments' finances were in a bit of a mess, not very different from Kazakhstan. And they both try to reduce their expenditure. Very worthwhile goals. And also, they thought that, hey, we have a magic bullet. While reducing the government's troubled finance, improving the government's troubled finances, how if we can improve the efficiency? And economic theory offered both the solution. It was a magic bullet. Just charge people money. Charge people money. How do you charge money? Well, reduce the government funding for the hospitals. So if you reduce the government funding for hospitals, they will have no choice but to go and, well, guess what? The hospitals were very successful. Very, very successful. This is one of the most effective policy implementation in the world. When you stop providing money to the hospital and encourage hospitals to get money from the patients, what do? They put their hand in your pocket and get the money out. Very, very easy. Unlike almost every other policy where there is a lot of difficulties in implementing policy, this one is immediately successful. Especially if you're lying on operation theater bed, it's very easy to get money from your patient. So, fee for service. Fee for service is an arrangement where you charge people every time they get a service. The more service you get, so now get this idea. Don't give money to hospitals. Encourage them to get the money from the patients, and let them charge each time they provide a service. So what's the incentive here? Get more money, by providing them more service. Because the more service you provide, the more money you can make. Of course, you don't have money, then they won't bother providing the service, and you don't have to pay, but that's okay, as far as the system is concerned. So it depends on the adjective that you like. You could say that the consequences were very undesirable, they were disastrous. They call it a calamity, whatever. China, which used to be cited as one of the best countries that having one of the best healthcare systems in the world in the 1990s, until the early 1970s, based on the 1997 data by a World Health Organization report in the year 2000, ranked it one of the worst in the world. So get this one. This is the genius of the reform. That within 10 years, you go down from one of the best to one of the worst. Very successful. If that was your goal, that's exactly what happened. India, on the other hand, had no such luck. It was pretty awful before, and it remained pretty awful later. In fact, it became more worse. So the reforms did not improve. So here's an interesting case, right? Similar reforms, top-ranking country goes to the bottom, low-ranking countries goes to the bottom with very similar reforms. You could draw conclusions why this will be happening. So why did China, not India, China have an excellent healthcare system through the early 70s? Like any good, any story, the story would be complex, but this one gives you a little bit of sense of why it might have been a very good one. The government provided healthcare, pay for it. The results were less expenditure. India, on the other hand, was a free market dream. And you may have heard about Indian central planning, but in the healthcare, they were very free market oriented, right from the start. The Indian policymakers like to run steel mills, letting it start. They don't care about healthcare, education, and all those things. Actually, Chinese central planners did care about it a little bit, but Indian ones, they had bigger things to worry about, like steel mills and railways and airlines. And healthcare, education, poor people, they can look after themselves. So private provision, private financing. So this system was already in the 1980s very, very private. It just became even more private in the 1990s. Very high expenditures. You can immediately see. It's not a proof. There's probably a correlation here. The public provision, public finances leads to less expenditure, improved healthcare status. Private financing, private provision leads to high expenditures. This is Counterintuitive. Because private is supposed to be good, yeah. Private is supposed to improve status, less total expenditure. Again, this is not a proof, it's just simple correlation. I've been telling a story that was very good until the 1980s, except that I don't have the data for you. And I don't have the data for you because all the numbers were recalculated from 1995 onwards. So if I give you the 80s data, it won't make sense after this. So in the year 2000, World Bank very helpfully, because many of these countries have their own quirky way of calculating numbers. So the World Bank decided to make them consistent. But instead of going too far back, they started in 1995. But in any case, whatever the trend that you see from 1995 was probably, if I showed you the 1985 number or 1980 number, it will just be even more. So what do we see here? Between 1995 and here, total expenditures go up. Total expenditures go up. These are the lines in both countries. And at the same time, private expenditures go up. In other words, you can see when the private expenditures go up, total expenditures go up. We're not concerned about this period. You can see that it starts going down. When the government expenditures go up, when private expenditures go down, the government expenditure, total expenditure goes down. So the opposite happens after 2001, 2002. But we're not concerned about that. The same point is made over here. Who is out-of-pocket payment? So out-of-pocket payment goes up, and government expenditure goes down. So when government pays less, people have to pay more out of pocket. And the previous one showed when people pay out of pocket, unlike what the theory predicts that it should go down, the total actually goes up. So we can all immediately see that these expectations of the economic theory and the reforms were not being met. That people were spending more, and society was spending more. Kazakhstan experience is exactly the same, by the way. So what were these wonderful reforms that these governments were doing? Well, they come straight out of textbooks. Decentralization, good. Kazakhstan also, very good, excellent. Give decision-making authority to the local people. Let local governments manage everything. Wonderful, no? How can you contradict that? When local governments manage their finances, they manage it well. Why? Because it's their life, their money. People are very prudent with their money. Well, both China and India get full marks for that. Both of them are very decentralized countries, just like ours. Operational autonomy for providers. Well, the argument has been that if there are too many regulations on government hospitals, they become inefficient. So what do? You give them more autonomy, freedom. In India's case, they already had a lot of autonomy. They were all private hospitals. There wasn't much regulation for that. There wasn't much public hospital. So what they did was even give them more. So in China, from complete control, almost complete freedom. They could do pretty much whatever. And there were some rules, but it didn't really matter. They weren't enforcing them. So this one, public providers were encouraged to earn revenues from patients. In India, it was already private, so they were already making enough money. But they started making even more money because a few restrictions that they had. Out of pocket payment by users, in here they were always paying it, so it really made no difference. So India was ahead of China in many ways, in that sense. They were already very privatized. So what are the results? Well, the expenditure started rising immediately. People couldn't access healthcare. 70% of the people in Chinese population said that they were the number one worry. The number one worry in the world more than fear of death of their loved ones, anything. Number one worry was healthcare. It still is number one, by the way, but it's not 70% now. Only half the Chinese population sees that they're worried about healthcare expenditure. So it has been different. In India, I haven't seen a survey. It was such a low priority, nobody even bothered to do a survey. Because when they were running airlines and railways and shipping, and they were very busy doing all those things. So in India, not much of a change. It's just the bad situation kept getting worse. If you're not agreeing with me, or if you are not, you haven't, you're not following the argument entirely, please just interrupt me. So what was happening? I won't go into that, right? Because I'm not talking about the recent, but it's available to you as notes. If you wish to do that. Most of these things that we saw in the 1990s, I didn't have any work. So now let's go back to the 1990s. Here is a healthcare system in both countries, which is almost, not entirely, but almost free market heaven. Free market heaven, almost. No, not entirely, almost. There's a competition among suppliers, right? Essential condition for a market to work. There were a lot of, especially in urban areas. Urban areas, full of hospitals. Not all entirely legal, by the way. Not all of them have actually a medical degree. But it's a free market. Patients are supposed to know which one they want to go to. Multiple buyers. A lot of buyers. One had a 1.1 billion population in that time, and the other one had 1.2 billion population. So it can't be a shortage of buyers. So a lot of suppliers, a lot of buyers, and you already have met most of the conditions for a free market. Information, you need information, right, to make the right choices. In healthcare, that's nearly impossible. So this condition was not met. Not in China, not in India, but nowhere else either. Healthcare is one of those things that you cannot do in that now. And if you knew that much about your own healthcare, then you don't need to go to a doctor, right? So that condition of a healthcare was not met. Everything else was met. But this market, in most product markets, most service markets, if there is multiple buyers, multiple suppliers, it leads to improved quality, lower prices, opposite happen. Could governments solve the problem? No. They can't solve the problems. As we would know, and as we have seen in your other classes, or actually you will see even more, there are government failures. There are government failures of, rigidity, all kinds of government failures, which we won't discuss because we are talking at the 1990s, which was a period of market reforms. I was talking about another phase I'm talking about. But do keep in mind that. But here I do summarize it. Healthcare sector is one of those sectors. I can't think of any other sector where the failures are so pervasive and so deep. Both markets fails, governments fails. Market failures are information asymmetry, not enough information. The government can solve the problem? No. Government doesn't have information either. Right? If the market doesn't have information, government has it, then the government can actually interfere. Neither of them have information. Markets don't operate in uncertainty. And governments have too much certainty. Right? Governments have too much certainty in the sense that nobody wants to improve. They love certainty. They have fixed rules, and they operate. And those rules, they don't know how to implement. The rules are poorly designed. Governments usually don't have the capacity to make the right decisions. So they make very poor decisions, and they stick with it. So market uncertainty, weak policy capacity, policy rigidity for the government. Markets have a problem of moral hazard. You all know the concept of moral hazard? No? We'll take it up in the class. We'll take it up in the, this is one of the fundamental market failures in economics. In government, cannot improve because they have vested interests. Right? Any policy creates its own vested interests. And these people fight to defend that current policy. In market failure is adverse selection. Again, you probably will say that you haven't come across the term, but I think we did in this case. So, last Wednesday, and you probably know that people who shouldn't be selecting something select something. People who are sick, they choose insurance, but the insurers don't want the sick. So government failures, they have their own rigidities, inflexibilities, due process, all those things. Conclusion of this is that both of them have a failure. Right now, so far, I have been dismissing market as a solution. Keep in mind that a lot of the same criticisms will apply to the market, to the government. So in other words, in healthcare, markets fail, governments fail. We have to admit this. When we observe government failure, we cannot say let's go to the market, because markets fail just as much. However, both the failures are not of the same kind. Market failures are very hard on the poor. It's the poor who cannot get the healthcare. Government failures are hard on the rich. You don't get enough high quality service. You don't have choice, which middle class, upper middle class, rich people don't like. They want more flexibility, more choice, better uniforms that nurses wear, more flowers in the hallway. They like those things. So, which the market is very good at providing. So, if you have to choose, so you can choose between which failure do you like, government failure or market failure, but do keep in mind that they have different impact. Government failures are undesirable for the rich and the upper middle class. The market failures are undesirable as far as the poor people are concerned. So government has to make a choice. So in the 1990s reforms, preferred choice, flexibility. More recent reforms, or the reforms or the arrangements until the 1970s, favored the poor people. No choice, only one class of service available. You don't like the service, but at least you had some service to get. In the market-oriented system, you can have hundreds of choices, but only if you have the money. Okay? So that I would say that market efficiency is actually the wrong goal to seek in healthcare. You cannot be efficient. It's impossible to be efficient in the healthcare sector. Because efficiency is a technical term. Because the failures are so pervasive. A better one will be effectiveness. Effectiveness itself is a technical term, but it's a little more relaxed term than efficiency. Efficiency, in technical sense, has a very specific meaning. It's the point at which demand and supply meet. And allocation cannot be improved. Well, in that condition, if it is achieved in the healthcare, a lot of people will suffer. In other words, the efficient point may be a suboptimal condition. So the equilibrium, a market equilibrium in an efficient healthcare market is a suboptimal experience for. Effectiveness is a more realistic goal because what it allows governments to make trade-offs between looking after the rich, looking after the poor. Giving a lot of flexibility, giving less flexibility. Improving as much efficiency as possible, but keeping equity in mind. Because that's what we are really looking for. Right? When you have to make a choice, you know that you cannot achieve either of them, so you try to achieve both of them as much as possible. It's definitely not good to be inefficient, but nor is it good to be inequitable. You really do need both. And in healthcare, it's nearly impossible to achieve so. But this is what idealized Idealized not as in rarefied, but idealized as in abstracted. An abstracted healthcare market looks